Good morning. So I'm Unikie Dkhar, and I have been asked by the doctor to take your CVS examination. Would that be okay with you?
Yes, sir.
Okay. So can I please know your name and age?
My name is Teddy and age is 21.
Okay. So for today, I'll first take the BP test, and for that, I'll be asking you some questions first. Would that be okay?
Okay.
Okay. So have you like when you came here, did you take any stairs or had any caffeine, or are you smoking?
No.
Oh, okay. So can you please place your hand here? So the hand must be placed. Now I'll be palpating the brachial artery. So I'll be placing the cuff. So can I roll up your sleeve?
Yes.
Okay. So okay. Okay. So I'll be checking for your radial pulse. Okay. So the PP of the patient, as we can see here, the systolic is 120 and the diastolic is 70, which is still normal. The next test will be the jugular venous pressure. So I'll be inspecting. So can we move to another location and I'll be taking out your shirt? Will that be okay with you?
Okay.
Okay. So right now we'll be inspecting the patient's neck. So can I ask you to move to the other side? Okay. As we can see here, there is no scars, bruises, or any surgical marks. So I'll be elevating his neck to a 60-degree angle. So now we will be identifying the patient's internal jugular vein and the patient's highest pulsation point. So I'll be moving your neck. So I'll be keeping the ruler in the sternal angle and the other. Yeah. So the JVP measure was 2.5 centimeters, and adding the 5 centimeters to the sternal angle to the right atrium. So adding both, we get 7.5 centimeters. If it was above 8 centimeters, it would have been considered as abnormal. Now we will be palpating the carotid artery and auscultating the carotid arteries. So can you face to the other side? Okay. Can you inhale and hold your breath? Okay. This is to listen for any bruits. Now we will be inspecting for the pericardial to inspect for any scars or enlargement, and we will be palpating the pericardium by using a pen light to see the apex beat. So we cannot see by using a pen light for the apical impulse, so I will be using my fingers to palpate and see the apical impulse. So still, if we cannot locate by palpating, we'll ask the patient to roll over to the left lateral decubitus. The apex peak is at the 5th intercostal space. So now we will be measuring with a ruler from medial to the midclavicular line. As we can see here, so the measurement with the ruler from the medial to the midclavicular line was about 2 centimeters. Okay, now for the abnormal precordial pulsations, they are actually the abnormal sounds. Heaves are found in the apex here, while thrills are found in the vascular area of the intercostal space. Now is the auscultation of the heart. I will listen to the apex and I will identify the rhythm. Okay, the heart rate is 88 per minute and the rhythm is regular. Now for the S1 and S2, I will be placing my finger in the carotid and I'll ask, can you please ask that? Okay, so S1 is heard more in the apex, while S2 is heard more in the base. Interval between S1 and S2 is shorter and S2 and S1 is longer. Now we will listen for the splitting sound of S1 and S2, and I will be placing the diaphragm at the pulmonic valve area, which is at the 2nd intercostal space, and ask the patient to breathe in and out. So please breathe in and out. Breathe in and out. Okay. So the breathing is normal and there is no splitting of sound. Okay, now we will be auscultating for S3 and S4. So we will be using the bell and we will be placing it at the apex of the chest. We will ask the patient to roll over to the left lateral decubitus. Okay, so no extra hard sound is heard. Okay, the next task is to listen for murmurs by using the inching technique. I'll be using the bell for this. Okay, so if murmur is heard in the mitral valve, I will be radiating the stethoscope laterally and superiorly to the mid-axillary line and posterior axillary line and infrascapular area. If murmur is in the aortic, we will radiate at the carotid artery. That's the end of